my name is Morgan Mitchell. I'm going to be the nurse practitioner today. I've already washed my hands before I've entered the room. This is my patient, Sarah Lair. Her birthday is January 7th, 2001. I noted her gait as she walked in the room was firm and steady with no abnormalities. And I'm also noticing that her posture is upright. She doesn't seem to be too bent over and doesn't have any abnormalities in that sense. I'm also noticing her speech as we were discussing why she came in today earlier. Her speech is articulate, it is appropriate for the situation. She's speaking in her native tongue, and she doesn't seem to have any abnormalities. Sarah, can you tell me your name?
Sarah Lair.
Can you tell me your date of birth?
January 7th, 2001.
Can you tell me where you are?
In the doctor's office.
And can you tell me the situation?
I'm coming for my 17-year checkup.
Yes. Sarah seems to be alert and oriented, and she does have a level of consciousness that is intact. I've also taken her vitals before we got started. Her pulse was 60, her blood pressure was 120/80, her respiratory rate was 16, her temperature was 98.6. Sarah, are you experiencing any pain today on a scale from 1 to 10?
Nope.
The patient states a 0 out of 10 scale. First, I'm just going to start by assessing Sarah's skin and nails. I'm noticing the color is appropriate for her ethnicity. I'm noticing that it is warm, dry, it is free of edema, free of moisture. She doesn't have any bruises, lesions, nevi, scarring, or any masses that I've noted. I'm also noticing that Sarah's facial symmetry is very symmetrical. I'm also starting at the top of her hair. I'm noticing her scalp, I'm noticing her hair color and texture is appropriate. It seems to be evenly distributed. I'm looking for any masses, any tenderness, any depressions, or any infestations or tenderness. Did you notice any tenderness?
No.
So I did not see any of that. Next I'm going to assess Sarah's ears. First I'm just looking at her external ears on both sides. I'm not noticing any abnormalities like any skin tags or genetic abnormalities. I'm not seeing any signs of inflammation like redness, swelling, dryness, any of the above. I'm also noticing the top of her ear, the pinna, is even with the outer canthus of her eye. I'm also going to palpate, and I'm not noticing any masses or any bulging. Sarah, are you tender anywhere? No tenderness noted. I'm also going to look inside in her tympanic membranes. Okay. Her tympanic membrane seems to be intact, and there doesn't seem to be any redness or bulging or any sign of inflammation. Now I'm going to test cranial nerve 8. Sarah, if you could repeat the 3 words back to me that I say.
Car star bar.
Okay?
Car star bar.
Great. Cranial nerve 8 does seem to be intact. Now I'm going to assess Sarah's eyes. I'm not noticing any drooping. They seem to be symmetrical and alert, and the skin on her eyes does not look inflamed, and her eyes don't seem to be drooping either. Now I'm going to test her cardinal gazes. Sarah, if you could just follow my finger. Great. All of her extraocular movements seem to be intact. Now I'm going to shine a light in your eye really fast, Sarah. Sorry. Her pupils are equal, round, and reactive to light and accommodation. Now I'm going to assess Sarah's nose. I'm first just looking to make sure it is symmetrical, and I'm checking for patency. Sarah, if you could take a deep breath in and out through your nose. Do you have any difficulty breathing? The patient denies any problems with patency, any difficulty breathing. I'm going to palpate for any tenderness. Does that hurt?
No.
I don't notice any masses or bulging. Now I'm going to look inside your nose. Her mucous membranes are pink and moist, and I'm not noticing any signs of inflammation, stenosis, no abnormal draining or anything like that. Now I'm going to test cranial nerve 1. Sarah, if you could close your eyes, I'm going to have you smell something for me. Can you tell me what you smell?
Peanut butter.
Cranial nerve 1 is intact. Now I'm going to look at Sarah's neck. I'm noticing the skin on her neck again. First I'm checking for color, temperature, making sure that it's warm, dry, appropriate for ethnicity. I don't notice any abnormal moisture, masses, lesions, scars, nevi, or depressions, or any tenderness. I'm noticing that her trachea seems to be midline, and I'm also going to palpate to confirm that. I'm also checking if I can palpate her thyroid gland at this point. She doesn't seem to have any abnormalities, and I'm not noticing any pulsations, any lumps, and everything seems to be symmetrical. I'm also going to palpate her carotid artery and the other one. Both carotid arteries are 2+ bilaterally. Now I'm going to auscultate her carotid for any bruits. I don't notice any bruits upon exam. Now I'm going to palpate her lymph nodes just to make sure that she doesn't have any sign of illness. Going to palpate pre-auricularly, post-auricularly, occipitally. I'm going to palpate her tonsillar, submental, and submandibular, as well as here posterior and anterior cervical, and I'm not able to palpate any of those. Now I'm going to look at her mouth again. I'm looking at her lips. They seem to be pink and moist and free of inflammation. Now I'm going to look inside at her mucous membrane, seem to be pink and moist. I'm looking at her tongue. Sarah, if you could lift your tongue as well. I'm looking at her posterior pharynx and the floor of her mouth as well, and I'm not noticing any abnormalities in that sense. Now I'm going to test for TMJ. Sarah, if you could open and close your mouth. I don't notice any subluxation, any tenderness, or any crepitus upon exam for TMJ. Now I'm going to examine cranial nerve 7. Sarah, if you could smile. Can you frown? Can you raise your eyebrows? Can you puff your cheeks? Can you purse your lips? Nice. Cranial nerve 7 seems to be intact. Now I'm going to assess cranial nerve 5. Sarah, if you could clench your jaw. Okay. And if you could close your eyes and tell me whenever you feel me touching your face.
Now. 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 Now.
Cranial nerve 5 is intact. Now I'm going to assess cranial nerves 9 and 10. Sarah, if you could open your mouth and say ah.
Ah.
Her uvula and her palate seem to rise symmetrically with phonation. Now I'm going to assess cranial nerve 12. Sarah, if you could stick out your tongue. Can you move it side to side? Cranial nerve 12 is intact. Sarah, can you shrug your shoulders? Cranial nerve 11 also seems to be intact. Now I'm going to assess your range of motion. Sarah, can you put your arms out? Can you bring them up high? Down low? Can you bring them behind your head? Great. And can you put them out again for me? Can you raise up against resistance? Down? Can you hold your arms like this? Can you push? Can you pull? Great. Her range of motion seems to be intact. Now I'm going to perform my cardiac assessment by listening to all 5 heart sounds with both the bell of the stethoscope and the diaphragm. If you could just breathe normally for me. Sarah's in normal sinus rhythm. I don't hear any murmurs or abnormalities. I'm going to palpate her radial pulses bilaterally. They are both 2+. I'm checking for cap refill and her skin turgor, making sure that it is brisk. You could flip your hands over, sorry. Brisk skin turgor and her cap refill is also less than 2 seconds. Now I'm going to do my pulmonary assessment. I'm going to listen to your lungs on the front of you and the back of you. If you could just take deep breaths each time you feel my stethoscope. and that completes my assessment. Thank you, Sarah.
Dot.